This is a Midwest Minute with Matt, concussion conversations that just make sense. Before we get started, a quick note: this podcast is for educational and informational purposes only. It is not medical advice and does not replace evaluation or treatment from a qualified healthcare provider. Listening to this podcast does not establish a provider patient relationship. Every brain injury is unique, and what we discuss may not apply directly to your situation. If you're experiencing symptoms or have concerns, please seek care from a licensed medical professional. If this is an emergency, please call 911 or your local emergency services immediately. Welcome to a Midwest Minute with Matt, concussion conversations that just make sense. I am the host, Matt Campbell, and I am the owner of the virtual Midwest Concussion Clinic. And today we're going to start with the foundation: what concussions truly are. If you've ever thought about concussions as a bruise to the brain or been told that you just bruised your brain, you've been given some outdated information. That misunderstanding or that misrepresentation of the complexity of what concussions truly are is why recovery can take so long for certain individuals. Concussions are a form of traumatic brain injury that disrupts the electrical signal inside the brain. Structurally, the brain looks normal, which is why when we do CT scans, X-rays, or MRIs, for the most part, they come back negative because there is no structural damage. If it were truly a bruise, bruising is bleeding. CT scans look for bleeding inside the brain. If it were traditionally a bruise, there would be findings on CT scans. It doesn't mean that everybody's CT scan is normal, but for the most part, concussions are not going to show up on CT scans. Concussions are a functional injury, so it's how the brain communicates back and forth. It's not structural change. I'd like to talk about the concussions and the brain being the computer system for the body. When you get a concussion, you disrupt the computer system that controls everything. That's why concussions are so complex and why symptoms present so differently to everybody else. Depending on where the disruption has occurred, where somebody is in different parts of their chemical makeup, or puberty or post-puberty or pregnancy or post-menopause, depending on where they are hormonally in life, symptoms will present very differently from person to person. They will even present differently from you getting hurt one time and then recovering and getting another injury down the road. The brain is at a totally different chemical makeup each injury. When we start talking about concussions, my whole goal early on is to try to get patients to not compare their injury to somebody else's or their injury to a previous one that they've had, because that differentiation on when concussion symptoms present and how concussion recovery will look. Concussions are a disruption of that electrical signal. It means that the messages are still getting around the brain. It's not like the brain doesn't work, but they aren't getting there as efficiently, as effectively, or at the same speed and endurance that we once felt before we got hurt. That's why a lot of people will describe feeling slower, feeling run down, or something just feels off after a concussion. It's hard to explain for people because I feel okay for the most part. I just don't feel like myself. There may be times where I feel really sharp and everything's really fast and really effective. And then there are other times where I just don't feel great at all. And that up and down is hard to communicate with people. It's why people tend to isolate after a concussion. I can't explain how I feel, or I'm tired of explaining how I feel because people don't necessarily understand it. No two concussions are the same. In the brain injury world, once you've seen one concussion, you've seen one concussion. If you're somebody out there who's helping treat concussions, you have to take it with that approach. You cannot assume that what worked for patient A is going to work for patient B. If you're navigating your own concussion recovery, you can't take what happened and worked with your friend and try to implement it into what you're doing. Even this podcast, things that I talk about may not be something that's happening with you or things that you're experiencing on your concussion recovery. And that's why it needs an individualized and multi-system approach to your concussion recovery. Calling it a bruise is one of the biggest disservices that still happens in today's treatment of concussions. And primarily, the reason we used to call it a bruise is because that's what we thought happened for the most part. Calling it a bruise now simplifies the injury in and of itself. Even the most difficult or most deep or intense bruise that we've ever gotten, you see progress over time. You physically see the injury getting better and better, and we get more mobility pretty consistently. Things move from A to B to C to D. Every step you take is a step in the right direction. With concussions, recovery is not a linear process. You may have some days that things go well and other days things don't go as well as they should. You may have an hour where you feel like yourself again, and then you spend the next 2 or 3 days on the couch. You may have 3 or 4 good days in a row where everything is great, and then all of a sudden I don't feel good. I feel off. Something is just not right. Calling it a bruise significantly downplays the complexity of the injury in and of itself. If it were just a bruise, rest alone would make it feel better. It's much more complex than that. When we look at the idea behind concussions being a disruption of the electrical signal, the first goal in treatment is identifying where those disruptions have come and how are we going to help support the brain so it reintroduces or it refocuses on its functional level. It's a functional problem. Functional injuries can be addressed with the right treatment, with the right integration at the right time. You are not broken. Your brain just needs the right game plan implemented at the right time. If this information helped you better understand concussions, please follow along a Midwest Minute with Matt, concussion conversations that just make sense. It's going to be a weekly podcast that we take complex neurological conversations and break them down into easy to understand and follow conversations for people no matter what their background is. On our next episode next week, I'm going to be talking about why symptoms will fluctuate up and down and what that fluctuation means and how we can use it to navigate through our concussion recovery. You can follow along our journey at mwconcussion.com on all social media platforms. Our YouTube channel is Midwest Concussion Clinic, and you can email me or shoot me a DM. You can email me at matt@mwconcussion.com. If there's a topic you like cover or something that you want to know about, you can ask that, and I will add it into an episode in the future. This is an episode of A Midwest Minute with Matt.